Welcome to Perspectives Online and also on air from WFSU Public Media. I'm Tom Flanigan. Thank you for joining us this program. Recorded on Thursday, August 27th for playback both on WFSU FM and also our WFSU Public Media Facebook presence on Thursday, September 3rd. Back in March and April, the hope was that COVID-19 and the resulting pandemic was going to be somewhat of a short-term situation. But now, of course, it's become apparent that we're facing a much longer-term circumstance, and that realization is helping to stoke an increase in depression and even suicide ideation and suicide itself. As this continues to go on, even in the best of circumstances, people can become depressed, they can be downtrodden, and all kinds of negative things can come out of that. But when you have something as overarching as the situation we now find ourselves in, it exacerbates so many of these situations. So we thought, gee, how about an all-star panel to talk about the mindset that so many of us are dealing with, and the fact that a lot of what we are undergoing right now may not even become apparent in the immediate future. This also may be a long-term manifestation. So, boy, we got some great folks to join us here via Zoom. And we start off with our old friend Jay Reeve, Executive Director of the Appalachia Center, who's back on deck with us. Jay, good to see you. You are in office right now, huh?
I am in office, Tom, as I have been pretty much throughout this. We are essential healthcare providers, and as long as we've got staff on the ground working in the hospital, in the crisis stabilization unit, I'm going to be in the office. So, yeah, I've, like I said, I've been here pretty much throughout. It's a pleasure to see you again.
It is always good to see you too, Jay. Well, another critical care worker joins us here for this chat, and that is James Smith at Big Bend Hospice, social worker there. James, thank you so much for joining us, sir.
Happy to be here. Thanks so much, Tom.
Let's also say hi to Beth Dees, who is a board member of NAMI Tallahassee and has a direct personal connection with mental illness. And we have so much to talk to you about, Beth, and it is greatly appreciated that you could come on deck and talk with us.
Thank you. Good to be here.
We say hey to Cynthia Foster, the operations manager at NAMI Florida, but also does an awful lot with NAMI Tallahassee, including something that we have talked about on this air for years, which is the Bluebird Run for Brookie B. And we're going to get into that too, Cindy, because it's changed a bit, again, given our current circumstances. But good to see you, ma'am.
Nice to be here. Thank you.
And a hard-working FSU freshman in the psychology department is a NAMI volunteer, and her name is Maddie Stults. Hi, Maddie. Thank you for taking some time out from, I know, which is a hectic first week back to join us for this.
Thanks for having me.
Okay, and Maddie, as long as we're in your neck of the woods or in your square here, what is your connection to the current discussion we're having, particularly when it comes to the threat of suicide ideation and all that? Is that one of the things that you're focusing on in your studies, or what?
Yeah, definitely. And I think that young people are always at like a higher risk for any kind of mental illness or mental strain. And so, especially now moving into college, after having my senior year cut short, I noticed a lot of mental health strain on my friends and on my classmates. So that's been interesting to follow, and sad too to see how the pandemic has been affecting young people.
Because you've got some multiple disruptions in life cycle that you're dealing with there. For many students, first time away from home, you come into a situation where the traditional expectation of a college experience has been turned on its head. Some folks actually going to class, some are virtually attending. You get together with a couple, three people, and suddenly, oh my God, will we be arrested for an improper gathering? We heard about that here just this past weekend. surrounding the university. So you put all that together, and Jay Reeve, throw it over to you. What does that do to the psychology of not just college and university students, but people who are maybe working from home, or they have to work in person and put themselves at risk? There's so many actually uncharted territories here. What does that do to the mindset?
I think, Tom, it's a good question. I think that uncharted territory is exactly the way to think about this, because, as you know, we haven't really faced a situation like this as a society for 100 years. And the nature of society and the nature of culture has changed so much. So there's two things, I think, that are, important to kind of keep in mind when you're thinking about the impact of what's happening right now. First part is that it does not, let me put it this way. The first part is that it impacts everyone. Whether you're completely fine, you're happy in your life, you're happy in your work, that has changed. You're either working from home, as you pointed out, with much more social isolation than you previously had, or you're at work because you're a critical care worker, which carries a level of risk with it that it just did not used to carry, even with all the protective things that folks can put in place. So everybody is under a significantly higher level of stress and anxiety than is typically the case. And, I remember back last spring, as you pointed out, when this first was getting going, and we thought it might be a briefer event than it has turned out to be, I was talking to Mayor Daley about this, and we were having this discussion about the similarities and differences between COVID and a hurricane, right? Because Florida, the context that we all have is, well, it's like a hurricane, right? Because every natural disaster is kind of like a hurricane, except, as devastating as hurricanes are and can be and are, right now down the Gulf Coast a little bit, they're over relatively quickly. The aftermath isn't over quickly, but the actual impact of the event, you're talking about 1 day, 2 days at most. And then after that, it's the long cleanup. So that's not what's happened with COVID. What's happened here is that the direct impact of the event has continued to roll. So that initial stressor that we all felt in March when we first started seeing cases pop up, that hasn't abated. If anything, that's gotten worse as different hotspots emerge. So there's a level of consistent stress and anxiety that everybody's experiencing. That's kind of the first part of it. And then the second part is to remember that people don't all respond to stress and anxiety equally. If folks have a genetic precondition for psychiatric illness, if they've got early childhood experiences of trauma, that makes folks more vulnerable to stress and anxiety particularly. So everybody's in kind of a harder place than they were before, and there's some folks who are in much harder places than they were before. So that's kind of my take on it, is you're just taking the anxiety level and cranking it up a few notches. And this will be my final thought on this right now, here's the tough part, that the things that we've traditionally done to make anxiety better, to bring stress levels down, are things like hanging out with your friends, being with your family, having physical contact with people you love, going to a party, relaxing. There's so many things that we can't do just when we need them the most. So I think that's what we're seeing, is this kind of across the board enhancement of general anxiety levels, which is worse for folks with some vulnerabilities.
A member of our panel who may be able to provide some insight along this line because of her personal experience, Beth Dees, you've had some situations in your life that have caused you an awful lot of stress and anxiety and anguish over the years. Tell us your story and what brings you to this panel and discussion today.
Well, the main thing is I live with bipolar disorder 1 and generalized anxiety. And so in having that, I've lived with some severe clinical depressions, and with that, I've had suicidal ideations. So I have had actual experience of dealing with the frightening thoughts and the psychic pain, and how I've worked to deal with that so that I'm here today.
Well, with the circumstances that we're seeing now, as Jay just enumerated with COVID, that feeling that no matter really what you do, it's difficult, if not impossible, to change these circumstances that we're in. The inability to have the social connections that maybe could help mitigate this. What's the personal impact on you? Are things worse now because of what we're experiencing here with these external stressors?
Well, I can say from my experience and from people that I've talked with, other peers in the community that I do stay in contact with through support groups and other peer organizations, that it is a lot tougher, and people are having a much more difficult time. I've talked with people that are having a lot more anxiety attacks. They're struggling with depressions. I know that I actually am well about 85% of the time. I feel like I do very well, but I have actually had an episode, and I thought I was doing okay, taking care of myself, doing everything I knew to, but I still had an episode come up about just 2 months ago. And I feel strongly that it was triggered by just the stress of so many things that we're facing, not just the pandemic, but, the racial tensions, politics. There's just so much going on. So I am seeing it. I am dealing with part of it, and I see other people around me, peers, that are struggling with it.
And that connects here. And Cindy Foster, if we could talk to you about this, since you are so deeply connected to the event that we have spoken about many times before, dating back to the death by suicide of Brookie B, and the Bluebird Run that has been put together in her memory, and also to promulgate awareness of suicide and suicidal ideation. So this young lady, for the benefit of those who maybe are not familiar with her story, kind of harkens back to some things that Beth was talking about, that even with treatment and a very supportive family and everything else, this young lady wrestled with this for years, and it finally had a tragic conclusion.
Yes, that's right. Yeah, Brookie B was a special gal, that's for sure. And Mary and Bill Bowers really were NAMI supporters and did everything that they could. Brookie was in the hospital, in and out of hospital several times throughout her years. And so we decided to have this Bluebird Run for suicide awareness and prevention, and in her honor, and also in September, because it is National Suicide Prevention Awareness Month. Mm-hmm. We picked Labor Day way back, I can't remember how many years ago that was. I want to say this is our 5th year, maybe 6th. And we chose Alfred Greenway because the Bowers lived near there, and Brooke and her parents would walk the Greenway, and there are Bluebird houses all over the Greenway, as most of you know, and that's how we came up with the idea of having it called the Bluebird Run. Now, as we move forward, that Alfred Greenway actually has trail markings for our Bluebird Run and Walk. So even though it's going to be virtual this year, if people want to get out and really experience the full-on event, they can come to the Greenway actually at any time, and safe distance from others, and just follow that nice Greenway. It is 3.1 miles, so 5K, and then, as we always had, a walk over the Heritage Bridge going into, all of a sudden I can't think of the place, but as we go over that bridge and look over Piney Z Lake, to the end of the bridge and back is a 1 mile walk. So many people did that too. It was, it wasn't really about the race. It was about people coming together and experiencing togetherness, sharing their loss if they are what we call loss. I think of local outreach to suicide survivors. That group, and those of us that may know someone that attempted suicide, and we're thankful that our loved ones are still with us. And then others that just understand that mental health is something that we need to talk about and shouldn't be stigmatized. And we get that opportunity to go get out there in the community and say, yes, I'm standing up. I am talking about suicide awareness.
And anyone who wants to find out more about the virtual Bluebird Run for a Brookie Bee, that is on the NAMI Tallahassee website then, Cindy?
It is, and you can register at bluebirdrun.com. Registration is open.
Very good. Okay, and that is coming up virtually, so you can do it at any time. You have a greater degree of flexibility, and being outside is going to be healthy anyway. James Smith, let's talk about your organization, which is, again, Big Bend Hospice, which is another resource we have when it comes to mental health issues. So many people depend on Big Bend Hospice and similar organizations to be a healing and a gentle facilitator of very stressful times in people's lives. So what are you seeing as far as Big Bend Hospice and the ongoing stress of not just maybe saying goodbye to a loved one, but being unable to say goodbye to a loved one? We haven't been through this ever before.
Right, absolutely. So it's definitely been an interesting several months. When everything first started, families, I've worked primarily in Leon County, providing services to the families. And we have it kind of split up into two different teams. So there's a home team and then what we call a care and comfort team that goes out and provides support to the assisted living facilities, nursing homes, and things like that. And one of the things that when I talk with my other social worker friends and colleagues and the nurses who go out to the facilities is that difficulty that families are having. They're not able to go out and visit with their loved one, or they're only able to do the window visits. And so, or if a family member has to go up to the hospital, oftentimes they're not able to go into the hospital and provide that support when they're in their last moments. And so it's been very difficult for families. They're feeling that additional stress, that additional, disruption to be able to find comfort and support. And that's what hospice's main goal is to make sure that people in their last stages of life have comfort and support. And so thankfully we are still able to, have our nurses go out to those facilities and have our home health aides go into the facilities to provide some additional support to those individuals who are in the facilities, who are in the hospitals and not able to see their loved ones. We're able to bring in our phones and do a Zoom or a FaceTime with their families so that they can actually have some decent time as well with their loved ones too. And so, hospice, we've been around for 35 plus years, and our goal again is to just continue to provide that love, support for families. And thankfully, over the last 3-4 months, most of my job has been doing just phone calls, which for any social worker, psychologist, having a therapeutic session over the phone is so difficult. And now we are finally starting to be able to go back into the homes, go back and provide that face-to-face support and really just be there. Another thing that I've been able to do with my time here at Big Bend Hospice is facilitate a support group called the Survivors of Suicide Support Group. That is a support group that has been going on for years and years. And I really just kind of got started with it in November of last year. So for 4 months, November, December, January, February, we were able to have a meeting. And then all of a sudden, here comes COVID, and these survivors, these family members of people who have died by suicide, are no longer able to receive that support either. And for the last 4 or 5 months, it's been me being able to just send an email to everybody saying, how are you, checking in. This past Monday, we had our first virtual meeting, and it went off so well. And it was just great to actually see people again, just like I'm seeing people on the screen right now, and being able to talk about the things that they've been going through and everything that Jay said, you know, the burden, the alienation, the distress, anxiety is still there. And when we talk to people who have loved ones who have died by suicide, the likelihood that they have had thoughts of suicide increases as well. And so being able to just provide that support and making sure that they're doing okay did my little social worker heart really well. So we're hoping in the next month or two that we can also do those face-to-face support groups again as well. So fingers crossed, everything's crossed.
Yeah. Fingers, toes, and eyes crossed there, Jim. That's for sure. If you're just joining us, this is a special edition of Perspectives from WFSU Public Media. We're talking about mental health in general, but also suicide and suicidal ideation in particular in the run-up to the annual Bluebird Run for Brookie B, a young lady who died by suicide here in the Tallahassee area back in 2012. And that event, which promotes awareness of this situation, is now virtual, and you can go on NAMI's website to find out some more about that. You can also go online to find Perspectives programs from our archive if you miss portions of this or you want to revisit any of our other Perspectives programs going back years, not only on our WFSU.org website, also our WFSU Public Media Facebook page. We try to have the most recent program up almost instantaneously from the time it actually appears on the radio. And you can go back and watch and or listen to it over and over again. Maddie, Stults, what are you hearing from other students at Florida State? Being right there in the freshman chaos of a particularly chaotic year, how are the other students handling this, or are they?
Yeah, I think it definitely varies a lot. There are obviously students who are less affected by the isolation because they aren't isolating, so that's definitely difficult. But I think the more prevalent thing is a lot of students, like including me and my friends, we were so ready to go into this new time in our lives and meet new friends and create this whole new world for ourselves, and that's very much closed off now. And it's so much harder. Like you can meet people through Zooms and you can meet people through socially distant gatherings, but it's that initial boundary that you have to cross to get through that, and to work harder at socialization is a lot harder now. So that's definitely a big obstacle.
And that just seems so counterintuitive, Jay Reeve, to us as human beings. You pointed this out before. James picked up on that too. We are touchers and huggers, and that human connection, and not just proximity or online or screen FaceTime, but actually being in the same physical space with other people, is kind of critical to our survival as a species, isn't it?
Yeah, definitely.
Yes, it is. It's it's interesting. There are decades of research that demonstrate pretty clearly, especially for infants and young children, how absolutely critical it is to have human touch, human proximity from their parents and caregivers. And that need doesn't go away. It's right, it gets transferred into other relationships. But one of the things that is, one of the many things that has changed now, and as Maddie was describing the experience of, first coming into college and having a lot of it be virtual or all of it be virtual, is that there's an actual biochemical response to invited touch, I guess is the best way to put it, when you're, hugging a friend, hugging a partner, hugging a parent. There's an endorphin release that comes along with that, which are, sort of the feel-good chemicals in the bloodstream. And now there's other ways to get that. You can get it through exercise. You can, depending on who you are, you can get it through certain kinds of, music or media or physical activity. But it's the endorphins associated with human touch that are the ones that kind of, nest who we are, nest our connectedness. And so with that disrupted right now, I think one of the things you're seeing, and Beth alluded to this a few minutes ago, is people are more on edge. Things are a little more jagged. There's a little more anger. There's a little more anxiety. There's a little more willingness for things to escalate quickly. And I attribute a large part of that to this is how we're connecting now. And it is, it's great. We can talk. As James said, we can see people. That's all much better than being totally by ourselves or being on the phone, but it's not exactly the same. So I think what we're going to be seeing is the impact of this for a little while to come. Even after, I firmly believe a vaccine will be developed, and I firmly believe that we'll, sort of move through this. But there's going to be some long-lasting impacts from what we're going through right now as a planet, really, because everybody's going through it.
Yeah, especially when you talk about those interactions. I'm thinking families, especially. What grandma or grandpa doesn't want to play with the grandkids?
Right.
And yeah, it's great to do it by Skype or Zoom or whatever else, but it is not the same. Beth Dees, what works for you? What kinds of I don't want to call them safe spaces, but what kind of happy places have you kind of found that can help to tamp down some of the negativity that otherwise all of us are dealing with right now? What works for you?
Some of the things that I use are walking my Labradoodle named Izzy. That's very important, and going out to the Greenway and taking her for a walk is something that I didn't do as much of, but I'm doing more now. And reading a good book is something that I do that just kind of takes my mind away from it. I've been watching old-fashioned movies, the kind that don't have a whole lot of violence in them or anything like that. I really find that I need to stay with funny, happy kind of subjects. I do have my husband there, so we have been talking a lot. So, I find that helpful. We don't have that many new subjects to talk about. I'm finding we're discussing the same things over and over, but just that conversation and reaching out to friends. I've even been mailing letters, just old-fashioned letters to people. That is something, I can't remember when I did, but those are things that give me a good feeling, that help bring me out of maybe a difficult place.
And that seems to be part and parcel of this too. And since so many of us, I guess, have always used the excuse, oh, I am so busy. If only I had the time, I would study philosophy or walk a Labradoodle named Izzy or any of these other things that we have pushed into the background because of that focus that we had on work or school or anything else. And now suddenly we find ourselves with this overabundance of time. Maybe that's it. We can't do this, but we know we can do that. And that again puts us more in control of a situation that at first blush seems uncontrollable. Does that help?
Yes. And Tom, I would like to mention one other thing that I thought of that has been very helpful are support groups. And there's a number of support groups, and NAMI Tallahassee has a number of them. They're called Connections, and they have been very helpful because you can get on there and talk about things that are concerning you. You know, you do talk about the things that are helping you to cope, but you also have people get on there that say, you know, this really sucks. This is very hard. I'm really struggling. And there's other people to share with you. So I think that for me, getting, and the support groups, as with everything else, have moved online. You know, not all of them. So there's about 10 mental health support groups in our area. But I know NAMI Tallahassee, I know DBSA, Depressive Bipolar Support Alliance, has moved online. So that's something that is helpful, not to just talk about the happy things and the things that are going well, but to talk about those things that are disturbing us at a deeper level. So I find that very helpful too.
Well, that helps break out of the isolation too. And Cindy Foster, that was something you talked about earlier, that so much, even suicidal ideation, is grounded to at least some degree in the concept that I am alone. No one else can understand or comprehend what I am going through, and this is the only solution I see.
Right. Yes. Beth, I'm glad you mentioned the support groups. I help facilitate the NAMI Family Support Group, and it is interesting how many people do feel they join our groups feeling so isolated and alone. And even without COVID, there is that feeling of no one else in my neighborhood understands what I'm going through, understands a mental health condition, and it's a safe place at no cost to the participants to join in on a Zoom meeting and just do a check-in. What are you doing? How are you today? How are you feeling? What's going on in your life this week? You know, and then moving from that to actually expand our conversation with everyone. And what we call it is group think, where we're all talking about who's had a similar experience, what worked for them, what didn't work for them, and just we end on a happy note of, okay, what is one thing that you are going to do for yourself this week that you're looking forward to? And just, it may be, you know, my grandkids are going to drive by tonight and I'm going to be able to wave to them and talk to them or something like that. And I'm a grandmother of 4, so I certainly appreciate that loss and that loss of touch. But yeah, the NAMI message is you are not alone and that there is hope.
And the rediscovery of the little pleasures, the tiny instances of happiness that maybe can be expanded.
Right.
Oh, okay. But I'll tell you, James Smith, you guys got a problem, because if you ask just about anyone, how do you want to go? Oh, some people want to go in a blaze of glory. But it seems, I read a survey somewhere, and I forget please forgive me, I forget the name of the document that it was in, but how do most people want to leave the earthly pale? In bed, surrounded by family and friends. Boom. That seems to be the consensus. And now we have a situation, at least for the time being, where that is, if not difficult, totally impossible.
No, absolutely. Yeah, you don't hear people who say, you know, one of the questions that we ask is, where is your pain today? And then after they share what their pain is, you know, what is your desired pain level? Nobody says they want to have a pain level of 10. And it's, you know, one of those general questions, where do you want to be? Who do you want to have around you? Obviously, I want to be home. I want to be surrounded by my friends and family if possible. You know, and it's not been easy. It's not been possible. You know, even for people who aren't dying, you know, they want to be surrounded. Like we've been talking about, like Jay's hinted on, we're social animals. We desire to be with other people, even introverts. I'm quite the introvert myself, but every now and then I like to actually be around other people. it's important. And so the opportunity to be out with friends and family is just so important. You know, over the past weekend, I was able to be with some friends from church, and, you know, we asked each other, are you doing the touching thing? Are you doing the, you know, elbow high five? And some people said, well, we're starting to hug again. And it was, you know, just the opportunity to embrace another human being is just so important. And like Jay said, it just gives that endorphin release and just floods the body with all of those good feelings. You know, and like you had been asking, Beth, what are the things that you do? Those are questions that we ask all of our families. What are your strengths? What are the things that you look for to help you get out of these down moments? And, you know, it's important to have what I call a good toolbox of things, because it works one day may not necessarily work another day, or at this moment be available. And so, you know, having all of those different things that you can do, whether it's talking to a friend on the phone, doing a Zoom, going for a run, punching a bag, eating some chocolate, whatever it is, just have as many different ideas and items available for you to try and get out of, you know, any negative thoughts, emotions you may be feeling.
Yeah, and alternatives to Maddie Stults. I remember our happy place when I was in school was just simply going into the local underage bar and getting hammered. I mean, that was what we did. That's how we decompressed from class and all that. But now that has been that door has been shut as far as that goes for the students, even if they are over 21. So what do you recommend to maybe your peers and other folks that you know, that how do we get through this, and how do you keep the focus maybe away from the negative places inside and try to connect to, you know, more positive things externally?
Yeah, a big thing for me has been a lot of the clubs on campus have been opening like Zoom calls and virtual opportunities, which is so great because you do get to network and connect with people. And they are doing a lot of socially distant events like hikes and walks and stuff, and that's so important. I know for me, since I have to social distance from my parents now because I'm living in the dorms, so for me, playing tennis with my dad every once in a while has been really great. Those safe activities that are still so meaningful in this time has been the most important thing for me.
Oh, okay. Good ideas there. And back to you, Jay Reeve. How has all this changed your operation at the Appalachia Center? There has to be some profound impact on just your day-to-day functioning there.
That's a great question. We the biggest one, and it's kind of happened now because it happened within the first month, is that we moved very rapidly to a lot of remote therapy and treatment. And, you know, it's interesting because we've all had across the state and country the technology to do telemedicine and teletherapy for a long time, and we've used it at Appalachia probably a little more than other places because we cover such a large geographical area. So we've got, you know, a clinic in Franklin County, we've got one in Madison County, and it's, rather than putting prescribers in cars, we've traditionally, or, you know, for the last 5 years, done a lot of telemed. But this really pushed us to pivot pretty much our entire outpatient operation, so that through April and May, that was entirely virtual. Now, in June, when the state entered phase 2, we started bringing some of that back in-house, but it was with a whole lot of socially distanced caveats. So we reworked all of our waiting rooms and all of our offices, and we had temperature checks at all of our entry points. So I think that was the positive thing there, was that we were able to pivot so quickly, and so were a lot of other providers of mental health services. The other place, though, that we've had to monitor is the incidence of COVID within both our patient and our staff population. And so we have Well, we have a formal weekly briefing about it, but I would say that minimally I'm talking to my chief of operations probably a couple of times a day about where we're at because it changes so rapidly. So there's that monitoring of the physical health of our employees is something completely new for us. I mean, historically, it's been like, if you're well enough to come to work, you're well enough to come to work. Otherwise, you're staying home sick. But now we've had to put a whole bunch of procedures in place to make sure that both our staff and our clients stay safe. So I think that's what we've been doing.
One thing I'm fascinated, though, before we get back into the main topic, just the fact that all of us now must undergo almost constant vetting, if you will. Yes. It's like having a job evaluation every day or every other day. And there is a factor of, dare I say, distrust it's on that. I can't just sashay into a place anymore. I have to be checked. Mm-hmm. It's like, I've known you all my life, but I have to check your ID. There is something just basically kind of disconcerting about that. Is that hurting our relationships here too? Yes, I know you, I love you, but here, I need to point this thing at your skull to make sure you're not going to kill me.
Well, the really interesting thing about that, if I may, is that it hasn't, in some respects, it hasn't changed what we do professionally as much because we're for patient safety and patient privacy, we're a closed system. We check folks who come in the front door. We've been doing that forever and ever. What I'm interested in is seeing this spread out into the world so that it's nothing new for those of us who are working in mental health care, and particularly those of us who are administering inpatient facilities, to have a lot of vetting at the front door. You kind of have to. But watching that extend to, Publix, barbershops, I think it makes people more conscious of what some of the risks are. I don't think that's an entirely bad thing, to tell you the truth, because I think people should be conscious in public settings of, okay, both, health-wise and physical health-wise and mental health-wise, you have to be sort of aware of what's going on in your surroundings. But it has certainly extracted a pretty large measure of casualness from our daily interactions.
That is true. That certainly is. Beth Dees, time has really flown on this one here. For folks who maybe find themselves in some of the negative places that you have been and you've had experience with, what kind of advice can you give them if you find yourself in a circumstance where self-destruction seems almost a logical option? What should they do?
Okay, talking about this is not easy, but it is important. The main thing is asking for help is brave. I would mention that there is a difference. This is something that I found, is I consider myself a happy, strong, confident woman. But when I start becoming sick, I start having constant thoughts of death. I start having psychic pain that seems unbearable, and it's like, how do I get away from it? So for me, one of the big things is to understand, to separate my thoughts out. Okay, we listen to our thoughts all the time, but when we're sick or when we're getting sick, those thoughts talk to us differently. And for me, I first had suicidal ideations when I was 27, and that was probably the most dangerous because I thought those thoughts were my thoughts when they were actually part of the sickness. So the thing that I would say is that if you can say, to yourself, these are not my thoughts, these are part of an illness, and to reach out for help in whatever form that takes. If that means picking up the phone and calling a trusted friend to say, I need to talk about this, and being blunt about it. If that means calling our mobile response team here that Appalachia has, and I know you said what you said about numbers, but 800, help me out, 342-0774.
I believe is right.
But there are people there that are ready to talk. If it means just, we know 211, picking the phone up and saying, I need to talk with someone. But it is that breaking those thought patterns and reaching out and asking for help. There's a guy, I don't know who he is, but his name is Matt Haig, and he said something that to me kind of sums it up. He said, soak up the views, take in the bad weather and the good weather. You are not the storm. So learning to separate the suicidal thoughts from your regular self can help, or it has helped me. Now, sometimes for me, what that means is simply I'm going to pick up the phone and call my psychiatrist, and there's going to be an adjustment to my medication. That can take time. If the thoughts intensify or multiply, I have admitted myself to a hospital voluntarily to keep myself safe. So, and I talked with a gentleman recently who has battled for many years and has had several suicide attempts. And I asked him, what would he say? And it was very simple. It said, please ask for help. Call someone, get some help. And they're going to tell you something that you don't want to hear, like it will get better. And he said, when they tell me that, he said, I have a hard time believing it. But he said, later on, the truth is, it does get better. And he said, I am still here and kicking. And he's dealt with a lot of suicidal ideation, and he's made it through it, and he's a brave soul.
You just hit on something that it reinforces something I heard from a friend of mine who is a substance abuse counselor, who has dealt very effectively with addiction by counseling people to develop what he calls psychic distance. You said that, Beth, where you split off part of your personality and say, well, no, wait a second, this isn't me. All right. There's the me up here that has some capability of dealing with whatever this alien thought pattern or behavioral response or whatever else is down here, but they're not the same. If you can maintain that separation, that is one of the first ways to start to get a handle on things and to begin a healing process.
It's a survival coping mechanism. Now, that doesn't mean it's easy. When you're in the middle of all those thoughts going at you, it's very frightening, very intense. So it does not mean it's easy, but it is the battle for your life.
And you don't have to do it alone, as you said, Cindy Foster, and that particularly goes when we get into the upcoming Bluebird Run for Brookie B. Again, for the benefit of folks who are just joining us, let's get some more information out on that before we wrap things up today.
That's great. Yes, you can find out anything about NAMI Tallahassee at nami-tallahassee.org. And then if you want to find out specifically about the Bluebird Run for suicide awareness and prevention that is virtually on Labor Day this year, go to bluebirdrun.com. And we want to thank our presenting sponsor, Appalachia Center, and our sustaining sponsors, which is Liebenhot Law and all of a sudden, and Tallahassee Memorial Healthcare. Sorry about that.
Very good. Thank you so much, Cindy. Any James Smith from Big Bend Hospice, any final thoughts you have, sir?
Well, I think one of the resounding things that I've heard is, that and seen is that new hashtag, in it together. And it's important that we all recognize that we are in it together and that there is support out there. And I'm glad that Beth threw out the 211, you know, because sometimes just hearing somebody that you don't even have to share your name, you can do it completely anonymously is so important. And so if you are having those thoughts, if you're having issues, worries, concerns, you know, reach out because there are people out here who are ready and willing to listen and provide that support for you.
Thank you, sir. Maddie Stults, before you run off to your next class via Zoom, any final thoughts you have, ma'am?
I am so excited for the Bluebird Run this year. I think it offers a really great opportunity for helping mental wellness in our community, but also even helping your own mental wellness by running it yourself. So I'm very excited for that.
Good luck with this semester, okay? I know it's not what you anticipated back when you got that acceptance to Florida State University, but just think of the great stories you're going to have to tell out of this.
Definitely. Taking the good with the bad.
There you go. I like that attitude. And you get the final word, Jay Reeve.
I'll try and keep it brief. Two quick things. First of all, I'm with Maddie. I'm very excited about the Bluebird Run this year. You know, we've been working with NAMI Tallahassee and with the Lost team on the Bluebird Run for the last 5 years. It is 5 years, Cindy. And we're there every year. I'm out every year. I think the last I heard was Appalachia still had the largest team, which I'm particularly proud of. So I'll see you on camera there. I'm so glad you guys are doing this year. The other thing I really did want to mention real quickly, and I don't want to embarrass her by saying this, but I have to tell you, after being in this field for 36 years, I am blown away by the kind of bravery that Beth just demonstrated in talking about her history. And that's the kind of thing that takes not only courage, but actually more importantly than that, total commitment to the folks that she's serving. Because Beth, you're serving as a beacon of hope to everybody watching this who is dealing with those kind of background issues. And I have to say, I think you blew it away. I think you did great. So just wanted to make sure that was out there.
Well, thanks. And I have one more quote I want to share because thank you, Jay. I appreciate that very much. And I just, it is very hard for me to talk about, but at the same time, I think it's very important. And the more we do talk about it and normalize it, if people know that they're not the only one thinking some of these thoughts, it does help. And Winston Churchill is one of my heroes. And he battled with the black dog of depression. You know, I've read a lot about him and he really struggled with it. And I just believe what he said, and it was never, never, never give up.
Best last word I think I've ever heard on this program, Beth Dees. Thank you for some great insight and wisdom today. Jay Reeve, Maddie Stults, Cindy Foster, and James Smith, thank you for taking part in this special edition of Perspectives, produced by WFSU Public Media in Tallahassee. Thanks going out to Taylor Cox, pushing all the buttons today. Over on the video side, Paul Dam and Amy Diaz de Villegas helping us out online. Of course, Trish Moynihan and Lydell Rawls, and Kim Kelling is our boss in charge of just about everything. I'm Tom Flanigan. Please join us again next week at this time for more great conversation on Perspectives from WFSU Public Media. Take care.